Have you had problems paying for health care in the past year? If you answered yes, you're not alone. A recent report from the Center for Studying Health Systems Change shows that 57 million Americans in 2007 were in families that had problems paying medical bills. That's an increase of 14 million people since 2003. While this affects both the insured and the uninsured, most people with problems paying medical bills were insured. About 2.2 million of them had to file for bankruptcy, and a much larger number reported problems paying for necessities and having to borrow money. To learn more, go to vhcf.org.
There are 49 free clinics throughout Virginia. While they differ in hours of operation and the array of services they provide, one commonality is the medical condition of their patients. I am delighted that nurse practitioner Donna Bowser, the clinical director at the LOYDE Moss Free Clinic in Fredericksburg, is here to tell us about them. Welcome, Donna.
Thank you for having me.
What kind of patients does the free clinic treat?
We see anything from the flu, earaches, sinus infection, to arthritis, bad back, high blood pressure, diabetes, kidney disease.
A whole array.
Yes, we do.
How do the patients hear about you? Where do they come from?
Well, they come from the local emergency room, the local hospital, local physicians' offices, as well as word of mouth. We treat patients anywhere from the age of 18 up to 64, because those less than 18 qualify for FAMAS in our state, and those above 64, of course, qualify for Medicare. They have to be below 150% of the poverty line. And some are employed and some are unemployed. Good portion of our patients are employed, though. They may be working 1 or 2 jobs just trying to keep their family afloat financially.
Do many of your patients have chronic illnesses?
Well, actually, Debbie, it's quite a bit. For example, the Virginia Association of Free Clinics estimates that about 70% of the free clinics population suffers from a chronic illness, and I would agree that's the same for the Moss Free Clinic. For example, 7 out of 10 of the patients I see have the diagnosis of diabetes, which of course is one of the chronic illnesses. We right now at the Moss Free Clinic have a waiting list for people with a chronic disease to get into a clinic where they would see the same health provider all the time, and that would be those with chronic illness. So right now only about 2/3 of those that need that service are able to obtain it in our clinic. So it's a big need that we have for chronic care.
And those who are on the waiting list for one provider, you take care of them.
Oh, definitely.
Through other providers until they make it off the list into one provider.
Definitely. We are so blessed that we have so many volunteer providers who are able to come, but maybe once a month or once every couple of months, rather than as often as we need them for the chronic care. So we're very blessed with that at our clinic.
So give us some examples of the different patient situations.
Well, for example, a couple of weeks ago I saw a patient, actually 2 right in a row, both of which had just lost their jobs. One had been in the same place for 12 years, and because of the change in the economy, she was out of work. Another patient had just gotten out of the hospital. Another woman was young, and she had a type 1 diabetes, and she had been trying every week. She worked as a waitress to come up with the $100 to pay for her insulin, and she had not heard about us, was seen in the emergency room, and they referred her over to us, and she was so thankful to finally be able to get her insulin without worried that she wouldn't be able to get it by the end of the week. Another patient I saw had diabetes, and she had a really bad infected toe. I had to send her to the emergency room. She got admitted on IV antibiotics and even needed a surgery, but she thanks us to this day for having, saved her life. Yet a lot of the credit, or most of the credit, goes to the hospital and all the specialists who saw her all free of charge to take care of her and make her healthy again.
What do you typically do to care for someone who has a chronic illness, Donna?
Just about anything they need health-wise. We give them their medications all free of charge. They can have regular appointments for their regular treatment, as well as if they get sick, they can come in for extra appointments. Any labs, radiologies, x-rays, any testing they need done, as well as emergency room, hospitalization, and surgery is all done locally by the generosity of our local hospital, Mary Washington Hospital. All the specialists in town will see them free of charge too, and provide care, like a cardiologist or an eye doctor or a gastroenterologist or orthopedics. We provide some on-site dental care, and we also provide very minimal mental health, but thanks to the Virginia Healthcare Foundation, we'll be starting a mental health program very shortly.
Well, we're happy to help make that happen.
Yes.
And eager to see the results of that.
Definitely. Well, they will be good because there are a lot of people who really need the help.
So you really provide a wide range of services that people need. Primary care services, certainly, but then the labs, the diagnostics that go with them, the medicines people need, and even specialist treatments. Remarkable. It's a wonderful thing.
Yeah, we are very blessed in our community, and most of the free clinics in the state offer, if not all of those services, most of them.
I know we hear that with the changes in the economy and things not going so well, that food banks, for example, can't keep food on the shelves. What kind of an impact are you seeing in terms of the economy at the free clinic?
Quite a bit, actually. We were just at the Association of Free Clinics annual meeting, and all across the state, including in our clinic, the numbers of patients are just increasing immensely for several reasons. One, some of them are losing their jobs, and so they need health insurance. Others, the cost of the health insurance is just going so high that either the employer can no longer offer it or the patient can't afford it anymore. And then the severity of illness, the patients are coming in very, very sick. And then the third way is just our funding is being cut. Right when we need it most, some of the state and the local communities, because the tax revenues are down, they have to cut the funding to us. And just when we need to hire more people, we can't. And so we're just hoping that next year we will still have the money to be able to take care of the needs in the community.
The irony is that when resources are the least, it's when services like the free clinics are needed the most.
Definitely.
Donna, tell us, you've been at the free clinic for 10 years.
Yes.
That's a long time. You must like it there.
Yes, I do.
Tell us what you like best about working at the free clinic.
Well, what I really like is getting people healthy again, making them so that they feel better. It's nice, several weeks ago I was taking care of this gentleman, and he came in really sick, got him on the right medicines, the right health care, and he said, I asked him how he was doing, he says, I haven't felt this good in years. And that makes you feel really good. And then the second reason is working with the people. There's lots of volunteers and the staff, and we all want to be here. We wouldn't be there if we didn't, and it's a very energizing and a very happy place to work because of that.
Well, you make such a huge difference in people's lives. I can see that. Other than the crush of the people
Right.
coming in and not being able to keep up with it, I can see how that would make you feel very good.
It does.
Donna, is there anything else you'd like our viewers to know about free clinics, or anything you would like to add?
Well, yes, I would. Thank you for asking. We have two basic things. Number one is if you're a patient out there and you don't have insurance, please call, go to your local free clinic, get the help you need. We'd much rather help you now when you only need 1 or 2 medicines instead of after you've been in the hospital and now you need 10. And number two is if you're a person sitting at home who likes to help other people, consider calling your free clinic. They are desperate for help. You don't have to be medically trained. If you can donate a few hours of your time each week, it will really make a difference, especially right now. We are really desperate for help, so thank you.
Wonderful. Thank you, Donna, so much for joining us and for all of the wonderful work that you do.
Well, thank you for having me. I appreciate it, and I'm glad to talk to you and anybody else, actually, about free clinics. So thank you, Debbie.
Our pleasure. If you are interested in identifying the free clinic closest to you, visit our website, vhcf.org.